Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'honorable Blaine Higgs. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Before I get started, I just want to thank the interpreters. They're doing such a great job, and it's very, very hard to do this continuously for a long time. And yesterday was quite a long press conference, so I just want to thank the interpreters. Un gros merci pour les interpréteurs. C'est vraiment difficile de faire ça continuellement pendant une longue période. Et hier, je sais que c'était une longue conférence de presse. And before I start, I have a cousin who sends me little funny things from the internet every day, or quite often, I should say. But it was my turn to send her something funny this morning. Today marks 5 years we've been in 2020. It feels like that, doesn't it? And then I saw something else on Twitter. It says, "There is no education like adversity," a quote from Benjamin Disraeli. And if I had an audience in front of me and I could ask everybody who has the COVID app downloaded on their phone if they could raise their hands. And I would love it if everybody in New Brunswick could raise their hand right now and download that app. Alors avant que je commence, je voulais dire que j'ai une cousine qui m'envoie des choses un peu comiques chaque couple de jours, des choses qu'elle voit sur Internet. Puis, mais c'était mon tour de l'envoyer quelque chose aujourd'hui. Ça dit, aujourd'hui, c'est 5 ans qu'on était dans l'année 2020. Et aussi, il n'y a pas une plus bonne éducation que adversité. Alors, c'est vrai ici au Nouveau-Brunswick, on apprend beaucoup. Et aussi, je voulais demander si c'est possible, si j'avais des gens devant moi, je voudrais demander, mets ta main en l'air, tous ceux qui ont le COVID app sur leur téléphone. Alors, j'aimerais que tout le monde dans Nouveau-Brunswick aura cette app. Il y a 4 millions de Canadiens qui l'ont maintenant. Alors, bonjour à toutes et à tous. Good afternoon, everyone. Je tiens tout d'abord à fournir certaines précisions quant à la conférence d'hier et à répondre à certaines questions. En ce qui concerne l'éclosion de la région 1, région de Moncton, la recherche des contacts nous a permis d'établir que la source de l'éclosion est liée à un voyage. I'd like to begin today by following up from yesterday's briefing with some further information and responses to questions. With regard to the outbreak in Region 1, which is the Moncton area, it is clear that the source of the outbreak is travel-related, and contact tracing has conclusively confirmed this. But for privacy reasons, I really can't provide any more information at this point, but this knowledge will help us to better manage the outbreak and slow its spread. If you have been informed that you have been in contact with a confirmed case, it is very important that you self-isolate and stay isolated for 14 days. And it is very important for anybody who can support people while they're self-isolating to do so. It's very important at this time. And at this time, there are 150 individuals in Zone 1 who are self-isolating and as such cannot spread the virus to others. And if everyone adheres to public health directives, we have a better chance of shortening the duration of this outbreak. In Zone 5, the Campbellton-Restigouche region, contact tracing efforts continue and the source of the outbreak remains under investigation. But conferring with my colleagues from the other Atlantic provinces and also with my own public health team, the language around how we're referring to that outbreak right now is because all of the cases can be linked, we're really calling it a community outbreak, but they're all linked. So at this point in time, we are where we are confident that we have close contacts traced and isolating at home. And the people that test positive at this point in time, for the most part, are going to be people that have been self-isolating at home and that we're expecting to pop up. So right now there are 320 individuals in Zone 5 now in self-isolation. And in this region, it is very critical that those directed to self-isolate do so immediately. Et dans la zone 5, région de Hamilton-Restigouche, la recherche des contacts se poursuit et la source de l'éclosion fait encore l'objet d'une enquête. À l'heure actuelle, 320 personnes sont en isolement dans cette zone. Il est absolument essentiel que les résidents de cette région qui reçoivent la consigne de s'isoler le fassent immédiatement. Et les gens qui les reconnaissent devraient leur offrir du support. C'est très important à ce moment-ci. We are working hard to limit the spread of COVID-19 in the community, and self-isolation is our best weapon in stopping the chain of infection. And again, I spoke of the layered effects yesterday with our border measures, physical distancing, masks, staying home when you're sick, getting tested when you're sick, isolating, etc. These are all very important. Also, while there have been confirmed cases of COVID-19 in several schools in Zone 5, to date we have had no cases of student-to-student transmission. In some cases, the schools are closed because people are self-isolating and it's closed for operational reasons. So we really want everyone to know that, again, the contact tracing is working, and we're feeling good about where we are at this moment in time and happy with the cooperation of the public.
Can everybody please mute your microphones? Merci.
Thank you, Bruce. So there were some people on the line who, some of the reporters who didn't have their mics muted, so Bruce was just making sure that that was being done because it does cause some feedback and it causes an echo. So, new cases. New cases, we have eight new cases of COVID-19 in New Brunswick. And there are 2 new cases in Zone 1 in the Moncton region, an individual aged 60 to 69 and an individual aged 70 to 79. There are 6 additional cases in Zone 5 in the Hamilton-Restigouche region, 1 individual aged 30 to 39, 2 individuals aged 40 to 49, 2 individuals aged 50 to 59, and 1 individual aged 60 to 69. So there are 5 individuals who remain in hospital, and 1 of whom is currently in intensive care. And I would like to ask everyone to please keep these families in their thoughts and prayers at this moment in time. To date, we have reported 292 cases of COVID-19 in New Brunswick, of which 90 are currently active. Aujourd'hui, j'annonce qu'il y a 8 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a 2 cas dans la zone 1, la région de Moncton, soit une personne âgée de 60 à 69 ans, une âgée de 70 à 79 ans, et il y a 6 nouveaux cas dans la zone 5, région de Hamilton-Restigouche, une personne âgée de 30 à 39 ans, 2 personnes âgées de 40 à 49 ans, 2 personnes âgées de 50 à 59 ans et 1 personne âgée de 60 et 79 ans. Il y a 5 personnes qui sont toujours hospitalisées et dont une qui est aux soins intensifs, et j'espère que vous pouvez tenir ces gens et leurs familles dans vos pensées à ce moment. Il y a eu à ce jour 292 cas de COVID-19 au Nouveau-Brunswick, dont 90 sont actuellement actifs. So knowing the source of the outbreak in Zone 1 is a good step in terms of keeping things under control and containing the outbreak. We can rule out community spread with the cases from that region because, again, if we can't trace the cases back to travel, then we have to call it community transmission. And if there's community spread, then that means differences in terms of what we need to do in next steps to limit the spread of the outbreak. So we're not in that position, so that's good news. As 3 unrelated cases of community spread over 6 days, community transmission over 6 days is the trigger for moving back to the red phase, one of the triggers in terms of risk assessment, and we really want to avoid that. And so that's why I am so grateful for all of the work that public health is doing with all of our GNB partners, with Ambulance New Brunswick, with Extramural, and the regional health authorities. Everybody is working so very hard to contain this and minimize the impacts to both of these communities, and really the impacts to the entire province. Our lab folks have been working really, really hard to make sure that we're getting our testing done as efficiently and effectively as possible. They're making phone calls in the middle of the night when they need to, and everybody is just working so very hard, and I'm so very proud of all of that work. Je voulais juste dire que toutes les gens qui travaillent sur les éclosions, nos partenaires, la santé publique, les gens ici au GNB, tous nos partenaires avec les réseaux, Ambulance Nouveau-Brunswick, Extramural, et les gens qui travaillent au laboratoire, c'est excellent, c'est extraordinaire le travail qu'ils font pour diminuer l'impact sur les communautés à ce moment-ci et pour avoir du succès en contenir le virus le plus vite que possible. C'est vraiment incroyable. Je suis tellement fière du travail que tous les gens font. We are at a continuous risk of new outbreaks because the COVID-19 virus is all around us. We have thousands of people coming into our province every day, and any one of those people can bring it with them. So whether they're essential workers, whether they're traveling for other reasons, whether they have exemptions or they don't have exemptions, the risk will always be there the entire time that we are in a global pandemic and we still don't have a vaccine. La constatation de 3 cas non liés de transmission communautaire en espace de 6 jours déclenchera le retour de la phase rouge et ce que nous ne tentons pas tous les moyens éviter. De nouvelles éclosions sont susceptibles de se produire à tout moment, car le COVID-19 est répandu dans toutes les provinces à l'ouest du Nouveau-Brunswick et aussi dans les États-Unis. Tant qu'il y aura une pandémie mondiale, on sera toujours à risque. Le risque ne sera jamais zéro. Alors, c'est pour ça qu'on devrait toujours suivre les directions de la santé publique. And as I said earlier on in the pandemic, the only guarantee is that there are no guarantees. But I can guarantee, and I have guaranteed already, that we are committed wholeheartedly. This entire province is committed. The government, all of our partners are committed to doing our very best each and every day to do everything we can to keep everyone safe. And as new information comes in, as we have new research and new data, we will continuously change our approach and our plans as need be. People are traveling in and out of the province every day, and we must manage the risk that comes with that. Living with COVID-19 requires that we continuously improve our approach so that we balance these risks with mitigation that is reasonable, sustainable, appropriate, evidence-based, and data-informed. That is why we are offering regular testing to those who travel for work from Quebec into Zone 5, which is an approach other jurisdictions and countries have used. We are learning from our experience with each outbreak and incorporating these lessons in our protocols and approaches. La recherche des contacts effectués dans le cadre des 2 récentes éclosions illustre bien ce qui se passe lorsque des gens, consciemment ou non, adoptent des comportements qui accélèrent la propagation du virus. Nous savons, par exemple, que les cas se sont multipliés parce qu'une personne a choisi d'aller travailler, même si elle ne se sentait pas bien, mais c'est ça, c'est que les gens ne restent pas nécessairement à la maison quand ils ne se sentent pas bien, soit aller à l'école ou aller au travail ou participer dans des rassemblements sociaux quand vous ne vous sentez pas bien, ou même quand vous sentez bien, il y a un risque. Il y a toujours un risque quand vous êtes avec des autres gens sans porter un masque, moins de 6 pieds, pour plus de 15 minutes. Tous les contacts étroits, ça, c'est les gens qu'on veut vraiment protéger. We know adherence is generally good in work settings, but that infections have occurred in social settings, breaks, lunchrooms, where people let their guard down and are in close contacts with others, not wearing masks and not maintaining 2 meters of physical distancing. We know that people can feel like they just have a cold and not get tested. They feel like they just have a cold and they still go outside of their home and interact with others closer than 6 feet, more than 15 minutes without a mask. We know that while this happens, that is when people are at risk. That is when we know that COVID-19 is really something that we cannot let our guard down at any time. And nobody does this deliberately. I can tell you honestly that we are probably all at risk in terms of letting our guard down, but we really have to be vigilant. And it's not about finding blame or fault. It's about the risks and how do we manage those risks moving forward. Don't give it a chance to spread. If you have traveled outside the Atlantic bubble and are required to self-isolate, you must do so. And the GNB coronavirus webpage has lots of information on how to manage this to protect yourself and others. If you have a travel exemption for work, follow the advice of Public Health and WorkSafe NB. Si vous avez voyagé à l'extérieur de la bulle atlantique et que vous êtes tenu de vous isoler, faites-le. La page web sur le coronavirus du GNB comporte de nombreux renseignements sur la façon de gérer cette situation, de vous protéger et de protéger les autres. Assurez-vous de bien connaître les symptômes de la COVID-19 et prenez les dispositions nécessaires pour passer un test de dépistage si vous développez des symptômes. Une liste des symptômes de la COVID-19 se trouve sur notre site Web. Si vous ne vous sentez pas bien, n'allez pas au travail, n'allez pas faire des rassemblements avec des groupes, ne va pas à l'école. J'insiste particulièrement sur cette mesure. Make sure you know the symptoms of COVID-19. There is a list posted on our website, and seek testing if symptoms emerge. Please do not go to work, don't go to school, don't socialize with other people if you are not feeling well, and I cannot stress this enough. Follow all the public health directions, wear a mask in indoor spaces, wash your hands regularly and thoroughly, and maintain physical distance. You have to do them together because in a layered approach, just doing one without the others do not have the most impact in terms of the effectiveness that they can. Please don't spread rumors. If you are fearful, if you have anxiety, manage the fear with facts from credible sources such as the GNB website, the press conferences, and reaching out to MLAs and government officials who can put you in contact with all the people that can answer your questions. We even have phone numbers and email addresses on our website. Get the facts. And please don't spread rumors in social media or on regular media. Above all, be kind and support your family, your friends, your neighbors, and your fellow New Brunswickers. Mais surtout, soyez bienveillants. Surtout, soutenez les membres de votre famille, vos amis, vos voisins, et tous vos concitoyens du Nouveau-Brunswick. Take notice of all the people who are working hard, yet still find a way to keep smiling and taking professional pride in their work. Kindness will go a long way in helping everyone get through this, so please always be kind. Thank you very much.
Bonjour. After experiencing such a low number of new COVID-19 cases for several months, I know the outbreaks in Zone 1 in Moncton and Zone 5 in Campbellton region are concerning for all New Brunswickers. But these developments do not mean that we have gotten off track. We have always expected that over time we would see increases in cases once again. What is important is how these cases are addressed and how we deal with the outbreaks. Nous avons agi rapidement pour mettre des mesures en place afin de contenir la situation. Comme je l'ai souvent dit, tout le monde suit les règles. J'ai bon espoir que nous pourrons renverser la situation rapidement et ramener tous les gens de New Brunswick dans la phase jaune. Many businesses are just starting to recover from impacts they experienced during the first wave of the pandemic. I know that businesses are continuing to feel the impact of COVID-19, especially in the zones that have moved to orange this week, where some have been required to shut down once again. I want to remind you that the Business Navigator service is available to answer any questions you may have. Since the pandemic began in March, this line has received more than 4,000 inquiries. I would encourage anyone looking for information about reopening a business, accessing available programs, or guidance on how to operate safely to call Business Navigator's line 1-833-799-7966 or email nav@navnb.ca. Strong, resilient businesses are crucial to ensuring New Brunswickers' economy not only rebounds from the pandemic, but also continues to grow in the months and the years ahead. Nous devrons continuer à investir dans nos entreprises et à travailler avec nos partenaires pour améliorer le climat des affaires. Nous devrons aussi nous assurer que les bonnes conditions sont en place pour favoriser cette croissance. That's why our government has made assistance available to keep our workers employed and enable businesses to continue to adapt to the new realities of operating during a global pandemic. The assistance is meant to be complementary to supports offered by the federal government and other partners while addressing gaps. For example, we have made working capital loans available for small businesses with 1 to 49 employees. These businesses can access up to $100,000 through the NB Small Business Emergency Working Capital Program. Working capital loans to help larger businesses respond to challenges associated with COVID-19 are also available through Opportunities New Brunswick. In addition, business owners impacted by the pandemic who have a loan with a government department may apply to defer interest and principal payments for up to 6 months. Nous sommes dans une situation qui est en changement constant. Nous allons continuer à surveiller les répercussions économiques et à répondre de manière proactive aux besoins des entreprises et des employeurs. Nous allons aussi continuer à travailler pour renforcer le champ d'approvisionnement de Nouveau-Brunswick en aidant les entreprises à trouver les produits et les services qui sont disponibles ici, dans la province. New Brunswick economy is continuing to rebound from the pandemic. Numbers from the Canadian Federation of Independent Business show that as of last week, 80% of businesses in our province that closed due to the pandemic have fully reopened, up from the 73% in September. We want to keep this progress going. Nous connaissons présentement un recul temporaire, mais en travaillant ensemble, nous pourrons redresser la situation rapidement. Ensemble, nous pouvons aider les entreprises qui ont fermé leurs portes à ouvrir de nouveau. We can help New Brunswick's economy not only rebound, but become stronger than ever. But to achieve this, we all have to be diligent. What is being asked of each of us isn't much. By doing our part, we can get the orange zones back to yellow while keeping the rest of the province in yellow as well. The great work being done by officials all across this province, by individuals all across this province, will see that not only will the curve get flattened once again, but we will rebound quicker into the yellow phase. And I'm excited about the potential of doing that in record time because I've seen such swift action by our experts, from public health, from our testings, from our labs, to our people in the communities that are just looking for one more way to protect themselves and others so we can continue as normal as possible in this life with COVID. So let's all continue to respect the advice of public health and follow the state of the emergency orders to make this vision a reality. We can succeed, we can be better, we can continue to grow, but we must do it together and be cognizant of each other and the conditions of which we are now living. Thank you. Merci.
Thank you, Premier. Merci beaucoup, Monsieur le Premier ministre. Merci, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions, votre question, dans la langue de votre choix. Chaque journaliste aura une question. We will now proceed with questions from the media. Each reporter will have one question. You have the right to pose your question in the language of your choice. Michel Corriveau, Radio-Canada.
Merci, Bruce. C'est une question pour Dr. Russell. Alors, Dr. Russell, le cas à mon seul dit que c'est issu de la cause d'un voyage. J'aimerais savoir si la personne qui a voyagé avait l'obligation de s'isoler 14 jours et si elle l'a fait.
Allô, Michel. Pour la confidentialité, je veux vraiment pas donner plus d'informations sur ceci. Le but de partager de l'information sur les faits que c'était quelqu'un qui avait voyagé, c'était pour nous rassurer qu'il n'y avait pas de transmission dans la communauté. Il n'y avait pas de transmission communautaire. Si c'était quelqu'un qui a voyagé à cause du travail ou quelque chose d'autre, s'il y avait eu une exemption ou non, c'est pas le but de partager l'information. J'avais une question hier des gens qui me demandaient, c'est quoi qu'on a appris? C'est quoi qu'on a appris de cette éclosion à Moncton? Je vais vous dire ce qu'on a appris. On a appris beaucoup de choses. Mais qu'est-ce que j'ai appris? C'est que j'avais des notes, j'avais une longue liste de choses qu'on a appris. Mais j'apprécie la question. Je veux toujours donner l'information qui peut protéger le public, mais je veux toujours protéger la confidentialité des gens. Alors, s'il y a quelque chose que je dois partager parce que c'est quelque chose qui va protéger le public, c'est ça que je vais faire. Pour le voyage, comme je vous ai dit, ça veut dire que ce n'est pas la transmission communautaire. La transmission communautaire, si on avait 3 chaînes dans 6 jours, ça veut dire qu'on va retourner en rouge. Alors, pour moi, pour partager le fait que c'était lié au voyage, c'était vraiment pour nous assurer que ce n'était pas la transmission communautaire. Qu'est-ce qu'on a appris? On a appris qu'il y a toutes les 2 éclosions, qu'il y avait des gens qui n'étaient pas à la maison quand ils se sentaient malades. On a appris qu'il y avait des gens qui ne se font pas tester, qui ne sont pas fait tester quand ils étaient malades. On a appris que chaque cas était au résultat de des gens qui ne portaient pas de masque, qui étaient entre 6 pieds pour plus que 15 minutes avec des autres personnes. On a su que la majorité des cas dans les 2 éclosions, c'était des adultes. On a su que la majorité de la transmission n'était pas quand les gens travaillaient comme tels, mais c'était des situations où ils jasaient, où il y avait quelque chose en hors du travail, en hors de l'école, avec des gens qui étaient plus proches de 6 pieds, portaient pas de masque pour plus de 15 minutes. C'est ça qu'on a appris. Ça, c'est pas vraiment nouveau dans la manière qu'on sait que depuis le commencement du pandémie, c'est ça les contacts étroits, c'est ça les gens qui sont plus à risque à contracter le virus. Il y a 12 000 personnes qui traversent nos frontières chaque jour. 12 000 personnes qui peuvent apporter le virus avec eux. C'est le danger qui augmente toujours parce que les cas autour de nous augmentent toujours. On a appris que les gens sont vraiment plus... qui ne prennent pas au sérieux le porter des masques et de distanciation physique et les rassemblements. On sait que les gens prennent des risques qu'ils ne devront pas prendre parce que les numéros de cas étaient tellement bas. On a appris que c'est vraiment important d'offrir le support et de ne pas causer les personnes de sentir mal ou de sentir honte qu'ils ont fait quelque chose de mal. C'est vraiment quelque chose que c'est une pandémie mondiale et on doit nous supporter les uns les autres. On a appris qu'il y a des gens qui continuent à mettre des rumeurs et de l'information qui est fausse sur les médias sociaux et aussi dans les médias. Alors, c'est ça que je peux vous dire sur le cas lié au voyage. So I'm going to repeat everything I just said in English because it's so important. People asked me yesterday, tell us about the travel-related case. Tell us about the travel-related case. Did they isolate? Did they not isolate? What were they doing? Where did they go? The only reason I share the information about it being travel-related is because from a public health perspective, that's a good news story because that means that it's not community transmission. Community transmission means we can't trace the source. Community transmission means that we are at risk of, if we had 2 more community transmission cases within 6 days, we'd be going back to the red phase. So I'm sharing this in a positive way, like, yay, it's not community transmission. It is travel-related. So I don't want anybody to feel guilty or upset or blamed or shamed for having traveled and having that be the cause of other cases. Because the good news story is that we have a public health team who is so committed and so dedicated They rose to the occasion with all our government partners, regional health authority, lab people, extramural, ambulance New Brunswick. There is nobody who is not working as hard as they possibly can to contain this outbreak. And that dedication and that commitment is going to continue until this pandemic is over and we have a vaccine. So what did we learn? That's the other question that was asked. Well, what did we learn from this travel-related case? I'll tell you what we learned from both outbreaks because there are similarities in the outbreaks. What did we learn? We learned that, again, there's 12,000 people that come across the border each day, and those 12,000 people each have the risk of bringing COVID-19 with them. And so we always have to have precautions in place, and we're trying to do our best to mitigate all of those risks, but the risk will never be zero. And it is increasing because the number of cases outside our borders continues to increase across Canada and across the world. We learned that people have become complacent about being aware of the ongoing risks and taking the appropriate action simply because our numbers were so low. We learned that it is important to continue to support one another, to not stigmatize, to not shame, to not blame, and to use as many constructive and positive ways to maintain public confidence and trust that we absolutely can, and protect people's confidentiality to be able to gather all the pertinent information and facts. I can guarantee you that all the information that public health needs to share to keep the public safe will always be shared. We learned that people were not 2 meters apart, they weren't wearing a mask, and they were together for longer than 15 minutes. As is the definition of a close contact, that is how you get COVID-19. We learned that the majority of the cases were adults. We learned that the majority of the transmission occurred when people were socializing, whether in the workplace, outside of the workplace, in the school, outside the school. All of the settings where the transmission occurred were not work-related. They happened when people were socializing on breaks or talking or outside of work settings when they were within 6 feet, longer than 15 minutes, without wearing a mask. Very close contact for more than 15 minutes without wearing a mask. So the bottom line is, we learned that people did not stay home when they were sick. They did not get tested when they were sick. And it doesn't matter how it gets into the province, it will be transmitted by people who are 6 feet or less apart, not wearing a mask for more than 15 minutes. We learned that people are still putting out rumors on social media and the media. And all of the public announcements that we've made around the public exposures were done to protect the public in case we really missed anybody. We thought we had all the close contact numbers and information, and we, again, as an extra piece of precaution, in case we missed anybody, we wanted them to be able to self-monitor and watch for symptoms. And if there is somebody who was at one of the locations and had symptoms and got tested, public health has that information, and that's also a good news story. So we need to continue to be vigilant. The next 14 days are going to be critical to make sure that we have contained these 2 outbreaks, and we're going to keep working very, very hard to make sure that we're doing everything we can to do that. And the other thing I wanted to say about children and schools, I am a parent, and my children are going to school right now, and they will continue to go to school unless I get a phone call directly from a public health nurse who says your child has COVID or your child is a close contact of somebody with COVID, or I get an email from the principal saying the school is closed, or I get an email from the principal saying the school is open, there's been an exposure, we need all children to self-monitor who are not close contacts, but they are expected to come to school, and I will send my kids to school. But again, I understand that there is a lot of fear and there is a lot of anxiety, but we are here to help. We are here to answer all your questions and make sure that you have all the facts you need to arm yourself with information to take the proper actions and steps.
Merci beaucoup, Doctor. Merci, Michel Corriveau. David Coach, Times and Transcript.
Yes, hi. The question is for the Premier. Prime Minister Trudeau has said he intends to raise the issue of harmonizing nursing home standards with provincial governments. I spoke to Sharon Tier, President of the New Brunswick Council of Nursing Home Unions, and Alphonse Dion, President of the New Brunswick Senior Citizens Federation. Both expressed concern about staffing levels, especially amid COVID-19, saying that they're too low at long-term care or nursing homes, saying staff are overstretched, facing burnout. Will the province increase staffing levels? And do you see these talks with Ottawa as an opportunity to do that?
I see the talks with Ottawa as an opportunity to discuss healthcare across the country. All premiers and territory leaders basically had a communique to the federal government back of 2 or 3 weeks ago, so with 3 major points. But the key point was the increase in the Canada Health Transfer to be used by provinces to look at different aspects of how we could improve health services and to our populations. This issue around senior care home and nursing homes, I think that I will certainly work with the federal government as we define, given what we've learned through this COVID experience throughout our country, where do we have opportunities, where can we make improvements? But to arbitrarily, say, well, okay, if we just increase staffing levels, everything will be better. That may be one component that needs to certainly be looked at, but there are other things that we need to do that would be maybe doing things differently in how we manage both resources in terms of people and buildings and service levels, because it's a bigger picture and it's a broader, and it varies in different provinces. The aging demographics are different, certainly in New Brunswick, than they would be in Alberta. So we have unique challenges here, but one size doesn't fit all. And certainly just looking at numbers and staffing levels is one component, but it is not the only component.
Thank you, Premier. Thank you, Mr. Coach. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, if a hospitality worker asks a customer to wear a mask and the customer says he or she has a medical exemption, should they just take the customer at their word? What are their rights in those situations?
Well, certainly in this situation, we're asking people to be honest and forthright if they have a medical condition and really cannot wear masks. That we will respect that. We've said that in our rules. Dr. Russell has stated that situation. Now, if we have an outbreak of non-mask wearers because of medical conditions, I guess we'd examine that and say, is this real or is this something else? Because the whole idea of keeping each other safe is everyone doing their part. So while we recognize certain limitations and the difficulties that some may have, that is a small number, and we're not asking for a medical certificate at this time, but we are relying on people's integrity. So if someone uses that ability unwisely or that would impact others negatively, we'll have to address that. But I guess I'd like to think people are bigger and better than that.
Thank you, Premier. Thank you, Ms. Hogarth. Alexandre Boudreau, Acadie Nouvelle.
Bonjour, ma question est pour le Dr. Russell. Est-ce que vous m'entendez bien? Bonjour. Dr. Russell, je voulais savoir si vous pouviez nous donner plus d'informations sur l'état de santé des personnes qui sont hospitalisées et qui sont aux soins intensifs.
La seule information que j'ai, c'est le nombre de personnes qui sont hospitalisées et qu'il y a une personne dans les soins intensifs, mais je ne sais pas, j'ai pas d'autres informations, mais je peux en trouver. D'habitude, je pouvais dire si c'est quelqu'un qui font, ça va bien, mais j'ai pas d'informations à ce moment-ci, mais je peux en trouver.
Merci, M. Boudreau. Andrew Watt, Telegraph Journal.
My question's for Dr. Russell. Dr. Russell, yesterday you said, when asked about the outbreak, the source of the outbreak in Zone 1, and I quote, it would be a bit challenging with respect to moving forward in a positive way. Today, you say it's about privacy. Earlier this year, the Premier said an irresponsible medical professional in their 50s traveled to Quebec for personal reasons, wasn't honest about the trip when asked, and didn't self-isolate when he returned. I'd like to understand why there's a difference in, how much information is being released in terms of these two cases, and have you received legal advice in regards to potentially revealing the source of this outbreak?
Well, Andrew, I will say that public health reveals information that is required to protect the public. And where confidentiality needs to be protected and should be protected, it is. Under the Public Health Act, I am obligated to share information with the public that is required to protect the public for their safety. So we are quite judicious about how we share information in that way. Comparing the two situations, all I can say is that from our perspective, what the public needs to know at this point in time is that all of the things that can be done from an outbreak management perspective are being done, that contacts are being traced and people are self-isolating. The people that need to get tested are being tested. And so when I talk about moving forward in a positive way in terms of all the lessons we've learned in all the different areas of the outbreak from the beginning of the pandemic till now, we will continue to evolve and improve and get better with respect to anything and everything that we can with respect to our response moving forward. So I guess in terms of managing the outbreaks and doing everything we need to continue to protect the public today and moving forward, I am committed to continuing to do that. Again, with the Public Health Act and the powers that we have, we use them judiciously. And in this particular situation, again, what does the public need to know today to protect them? And I believe that all the information that we have provided with respect to these two outbreaks has been timely, transparent, up to date, and appropriate with respect to protecting the public.
Thank you, Mr. Waugh. François Leblanc, Radio-Canada.
Oui, bonjour, Dr. Russell. J'aimerais que vous expliquiez les raisons pour lesquelles il y a des compétitions sportives dans la zone 1 qui est en phase orange, qui ont eu le droit de continuer comme une compétition de culturisme, du bodybuilding. Et pourquoi les Wildcats de Moncton, de la Ligue de hockey junior majeur du Québec, ont eu le droit de retourner faire leurs entraînements? Est-ce que leurs matchs qui sont prévus à Moncton durant la semaine au Centre Avenir vont avoir lieu?
Alors, je vais répondre à la question avec 2 points. Et un point, c'est sur les revisements qu'on a fait avec les différentes phases et que continuellement, on va les réévaluer avec la nouvelle information qu'on a à chaque étape et chaque phase, au fur et à mesure qu'on reçoit d'autres informations. Les situations avec les gymnases, c'est vraiment quelque chose qui était décidé pour la phase orange avant l'éclosion. Alors ça, c'est quelque chose qui a été déjà décidé avec l'information sur les risques que les gens ont au sujet des gymnases. Mais au fur et à mesure qu'on a d'autres informations puis d'autres recherches, on peut réévaluer ces décisions sur quoi ce qu'on fait dans les différentes phases. Ça, il n'y a pas de question sur ça. Sur la situation avec les joueurs de hockey, les gens de santé publique, les gens de mon équipe, on a eu des rendez-vous avec les personnes impliquées avec l'équipe et ils ont évalué leur plan opérationnel pour les gens qui jouent au hockey et aussi le staff, parce que c'est quelque chose que c'est leur carrière, c'est leur travail. Alors, les joueurs et les staffs ont permis de voyager à leur place où ce qui demeure et aussi à le centre à venir pour les pratiques. Alors, dans la phase orange, c'est vraiment les mesures qu'on veut soient suivies. Et tout ce qui se passe maintenant, c'est correct. Et au fur et à mesure qu'on a besoin de réévaluer, on va faire ça certainement.
Merci, M. Leblanc. Mia Urquhart, CBC.
Thank you. My question is for Dr. Russell. Have you been able to rule out community transmission in Zone 5?
So we are continuing to do contact tracing. I was speaking with one of my colleagues from one of the other Atlantic provinces where it took them several weeks actually to find the original source of an outbreak. So we're continuing to look into that, and we're working very, very hard to trace that back. But every single case that has been identified right now, and all the close contacts are linked to the same outbreak. So that's all I can tell you at this moment in time, and other than that it can take a while to have the index case pop up, but we're still looking.
Thank you, Ms. Urquhart. Thank you, Dr. Laura Lyles, CTV.
Thank you. My question is for the Premier. There have been some reports lately of students not complying with mask requirements along with not enough of a supply of masks in some areas. I'm wondering if you've heard of this happening, and if so, how it's being addressed.
Well, certainly I'm not aware of any shortage of masks, and we do have some non-compliant issues that I'm not aware of specifically, but that are occurring, and our team from public safety are evaluating those situations, visiting with those with any complaints we would see, and then making the necessary accommodations to see that they become compliant. So as I've said in other sessions, it isn't about enforcement in the sense of how many people can we fine. It's about how we can encourage people to follow the rules and stay compliant with the public health guidelines. And we do track down, any complaints that we have and visit directly as required. Sometimes phone calls, sometimes other means of connection, but we do track any sort of complaint seriously to ensure compliance.
Thank you, Premier. Thank you, Ms. Law. Meg Cunningham, CHMA, Sackville.
Hello, my question is for either of you, whoever feels most comfortable answering this question. I've interviewed families in rural New Brunswick who are concerned about how they might access COVID tests since they live in rural areas without a vehicle, and the closest testing center is up to 30 minutes away. Are there plans to provide rural communities with a mobile testing site, especially considering the recent outbreak?
My understanding is the RHAs are in charge of the testing strategy with respect to the locations and whatnot, and certainly in certain situations they do have pop-up centers as a result of certain types of outbreaks and settings. But at this point in time, I don't have any other information specifically other than that some pop-up sites can occur, but that's really the RHAs who are dealing with that. And we actually did one in St. Stephen recently when there was an outbreak in Calais. So again, the RHAs manage that, and it's usually based on the situation as it's unfolding as we get new information around different outbreaks and situations.
Perfect. Thank you, Doctor. Thank you, Ms. Cunningham. Adam Harris, Telegraph-Journal.
Thanks, Bruce. Question for Dr. Russell. Dr. Canada's Chief Medical Health Officer, Teresa Tam, says that kids can trick or treat safely with the right protocols and even should for their own mental health of some kind of normalcy. I just wanted you to address this discrepancy and why that can't be done in two regions in New Brunswick.
Well, I did read what Dr. Tam said, and I'm aware of that. For the New Brunswick approach in terms of our phases, we are really talking about two outbreak settings, and there's not really a discrepancy. We need New Brunswickers to follow the guidelines that we have set out for the orange phase, and we're offering different suggestions and creative ways to celebrate Halloween. So, and again, all the information that we receive from Public Health Agency of Canada from the beginning of the pandemic has been guidance, and then we take that information and then we tailor it to our own jurisdiction and our own situation and our own epidemiology.
Thank you, Mr. Harris. Megan Yamoa, Global News.
Thanks, Bruce. Premier Higgs, can you please explain the 4-month business loan deferral process? And at this time, is it only for businesses in Zone 1 and 5 in the orange category?
4 months, what?
Can you please repeat that?
Yes. The 4-month business loan deferral process?
Oh, the process for business loans. So basically what this allows is that in the event of a business and they present their case to navigators or ONB, and they basically outline what it looks like for their strategy, what they need for bridging funding in order to get through kind of a temporary low spot due to COVID, and we provide loans, interest-free loans, in order for owner to bridge that gap. There's also, there's a couple different formulas for small businesses and larger businesses. And then there's also, we're deferring interest rates and deferring taxes. So it's a combination, but based on evaluations directly with businesses, and I don't know the exact number. I think today I mentioned over 4,000. I think it's significantly higher than that have actually reached out and been part of this program.
Thank you, Ms. Yamoa. Thank you, Premier. Steinbach, Radio-Canada.
Bonjour, cette question est pour le Premier ministre Higgs. Bonjour, c'est concernant WestJet. Comme vous le savez sûrement maintenant, la compagnie aérienne a décidé donc de suspendre indéfiniment 100 vols à toutes les semaines. Et ça touche deux régions du Nouveau-Brunswick, Moncton et Fredericton. Il y a le Premier ministre de l'île du Prince-Édouard qui dit qu'il est très inquiet et demande l'intervention d'Ottawa. Est-ce que vous demandez l'intervention d'Ottawa et est-ce que le Nouveau-Brunswick peut faire quelque chose?
Well, I certainly agree with my colleagues. This is extremely concerning on what is the what's the outcome, the impact. We know that airports, many have received or had about a 95% reduction in traffic. And I know that, there's a combination of factors with that certainly people aren't traveling too much. Certainly with our bubble that we have here in the Atlantic region is a factor as well. But I think it's the reality of what we see today in certainly not only dealing with COVID, but dealing with airports in terms of the transportation and how long is it going to take for it actually to come back. And, and I've met with different airport authorities that are talking, years, not necessarily months or weeks. I think it's time that, we looked at an overall strategy here in New Brunswick and how do we get service back to our New Brunswick citizens the fastest, and what does that look like? So over the coming months, I'm hopeful that we can have transportation discussions with certainly our airport authorities and what is the best model that could give us a long-term, not only a long-term view on what's best for New Brunswick, but also a short-term fix to have access. But it was sad news indeed, and I know it's not something I don't think you can bridge without having a plan going forward.
Thank you, Premier. Merci, Mrs. Steinbach. Brianna James, Northern Light.
Thanks, Bruce. My question is for Dr. Russell. A close passage in Bathurst said some staff in isolation as a precautionary measure after being exposed to a positive case. Can you elaborate on that situation and what safety measures are now in place for students and staff at the school?
Oh, I just missed the very first part of your question.
Can you repeat it, Brianna, please?
No problem. In Bathurst said staff are in isolation as a precautionary measure after being
broke up at the beginning.
Can you just elaborate on that situation and what measures are now in place for students and staff at the school?
I can't hear
Brianna,
the very...
Which school are you referring to?
Place des Jeunes in Bathurst.
Place des Jeunes and parents, teachers.
I don't have that. Other than, I can answer in a general way. Hi there. So what I can tell you is that if there is a situation at that particular school, the students and staff involved would have been contacted directly, and if there's any indirect messaging, then they would be contacted by the principal. So the principal would contact the entire school population to say school's open, school's closed. The principal would be contacting the entire school population to say, the people who need to be self-isolated if there was an exposure are self-isolating at home, and therefore it's safe to send your children to school. But I don't have the information in front of me about that particular school, but EECD can get that for me and I can get it to you. But I guess what I can say is that publicly, there would not be any information that necessarily, I guess unless there's a public exposure, but the school community itself would always be informed by the principal, and then any individuals who are either diagnosed with COVID or close contacts with COVID-19 would always be contacted directly by public health. So that student population and the staff there would have the knowledge and information from either public health or from the principal. For all the cases so far in both outbreaks in Zone 1 and Zone 5, first of all, there are very few children that have been infected, and any of the transmission that has occurred has been from adult to adult or adult to child, and not necessarily in a school setting. So a lot of the transmission is happening in different social settings. So again, each school community will be communicated directly with through their principal, and any contacts or cases, close contacts and cases are communicated with directly with public health.
Thank you, Ms. James. Jean-François Boisvert.
Oui, ma question est pour le Dr. Russell. Si j'ai bien compris, la durée de la phase orange dans les zones 1 et 5 doit être réévaluée d'environ 14 jours après l'entrée dans cette phase. Vous pourrez peut-être me corriger si ce n'est pas le cas. Mais est-ce que les élèves de ces deux zones doivent prévoir de demeurer masqués à l'école jusqu'à cette réévaluation, ou est-ce que vous avez prévu des allègements en cours de route ou dans les jours à venir, advenant qu'il y ait moins de menaces directes dans les écoles?
Comme je viens juste de dire en anglais, les éclosions dans zone 5 et zone 1, il y avait vraiment peu d'enfants qui étaient impliqués. C'était de transmission d'habitude hors des classes et des situations de travail. C'était des situations hors de social, mais pour les zones orange et les directives, c'est vrai qu'on aimerait évaluer chaque 14 jours parce que c'est la période d'incubation pour le virus. Et d'habitude, quand on écoute nos épidémiologistes dans notre équipe, c'est eux qui donnent beaucoup d'avis sur les changements qu'on va faire avec les risques. Mais parce que les directives sur les masques sont vraiment tout le temps dans la zone orange, à ce moment-ci, je dirais que ça va continuer pendant que les zones sont dans la phase orange.
Merci, M. Boisvert. Tom Bateman, Times and Transcript.
Oh, hi there. For Dr. Russell, Doctor, you spoke about people not getting tested after feeling unwell as one of the things we've learned from Moncton and Campbellton. In general, are you unsatisfied with the number of COVID-19 tests that are being administered across the province? Or I guess put differently, should New Brunswickers have a lower threshold for getting tested because of, say, a single symptom like a scratchy throat or the sniffles? Thanks.
Hi, Tom. So basically, from the beginning of the pandemic, we've always been trying to keep our demand and our ability to meet that demand and through 811 and in terms of getting referrals and having testing available in terms of human resources and pop-up centers and assessment centers. So in terms of the whole process and machinery behind it, we've always been evolving as the situation has been evolving, including with the science around the different type of testing that can be done. And certainly with our symptom list, people definitely have the option of getting tested with very mild symptoms, including only having one symptom. So there's never been a barrier for people to get tested, and certainly there's no barrier at this moment in time. Should we be encouraging more people to get tested and have a lower threshold? Again, it's a balance between having people make individual judgment calls about their own health. But in the context of a pandemic and rising cases outside of our province, and knowing that we do have thousands of people traveling in and out of our province every day, it's probably not a bad idea to have a lower threshold at this point in time. Certainly with there being 2 outbreaks in the province, and there's 2 zones in orange right now, that is probably a good indication that people should really be very conscious and very, very aware of the options available for testing and to take advantage of them even with very mild symptoms.
Thank you, Mr. Bateman. John Chillibeck.
Hi, thanks, Bruce. It's a question for Dr. Jennifer Russell, and it's not about onions. I just talked to Krista Ross of the Fredericton Chamber of Commerce about businesses asking if patrons have traveled to or from the zones, the Campbellton or Moncton zones. And she said that the last time there was an outbreak in the Campbellton area, public health advised not to ask patrons where they're from. I was wondering if that advice still applies now, why that advice is being given, and what are the restrictions or protocols for people from those orange zones traveling to businesses outside their communities?
Okay, so I'll start with what are the the directions for people who are traveling outside the orange level. First of all, non-essential travel in and out of the zones that are in orange right now is not recommended. So if it's essential, that's okay. But if you have traveled into and out of those areas and you've had interactions with people in those zones, either you've attended a gathering or events or went shopping or visited, and especially if you've been in contact with people closer than 6 feet for more than 15 minutes without a mask on, while you are in the orange level, you need to follow these following measures for 14 days after you return. You must wear a mask at all times when in public, indoors and outdoors. You have to watch yourself closely for symptoms and get tested as soon as possible when they develop, and isolate yourself. Limit your contact to your 2-household bubble and do not participate in organized sports. Do not visit personal service businesses such as hair salons and spas, and do not visit gyms or fitness facilities. Do not visit casinos, cinemas, amusement centers, etc., and avoid visiting those most vulnerable to COVID-19, including those in nursing homes and other adult residential facilities. Wash your hands or use hand sanitizer frequently. Maintain a 2-meter distance from others and avoid gatherings such as social events and churches. So that having been said, we're not telling business owners what to do or not do, but we're encouraging people not to ask those questions about whether they've been to those zones or not, because as the Premier said, we're using an honor system. We expect people to follow the rules, and we expect people to take responsibility for their safety and the safety of all New Brunswickers. So I think that's pretty much all I have to say on that, and thank you for your question.
Mr. Chillivack. That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup tout le monde.